Medical imaging, the technique and process of imaging the interior of a body for clinical analysis and medical intervention, as well as visual representation of the function of some organs or tissues. X-ray is a type of radiation that can pass through the body. They cannot be seen by the naked eye and you cannot feel them. It is used to examine most areas of the body and mainly used to look at the bones and joints, although they are sometimes used to detect problems affecting soft tissue, such as internal organs. In some cases, a substance called contrast agent may be given before an X-ray is carried out. This can help show soft tissues more clearly on the X-ray. Standard operating procedure for X-ray are as follows. Using proper techniques for X-ray procedures, quality image, and less radiation dosage to the patient. A good communication between the radiographer and the patient is highly required to avoid re-exposure. A logbook is provided in order to input the complete data of the patient before doing any examination. Adequate radiation protection to all people in the area in X-ray section. Lead barriers, gonadal, thyroid, and lead gown are used. No X-ray examination should be carried out without a written request from the requesting physician. For admitted patients, clarification should be made upon receiving the examination request to ensure that the procedure requested is correct. If the patient is pregnant, but the exam is a necessity, consult the requesting physician. Provide an abdominal shield for the patient and required a signed consent prior to proceeding with examination. Some types of X-ray procedures involve a contrast agent, such as barium swallow, barium enema, KUB-IVP, upper gastrointestinal series, intra and post-op T-tube cholangiogram. Inquiries, scheduling of procedures, releasing of results, takes place in the information of the radiology department, flowchart, organizational chart, vision and mission of the hospital can also be seen in the information, as well as the certificate of radiologist, memos, schedule of duty, and the special note for the graveyard shift staffs. The printed patient preparation, calling cards, and list of CSR supplies that are needed for the special procedures are also present. Important files such as service reports, LTO updates, and updated PRC licenses are also well organized and compiled. The reading area is located next to the information. The DICOM images are being sent to the radiologist through Dropbox and RAMSoft. We also have portable X-rays in C-arm that are mainly used for admitted patients, especially for medical ICU, neonatal ICU, and isolation unit for COVID-positive patients. The PMMG MPC Radiology provides a high level of customer service to patients coming into the department and ensures they are timely taken back for their scheduled service. The X-ray room for COVID-positive patients is located in the Medical Arts Building. At least 2 radiographers are required in order to perform an X-ray procedure of a COVID-positive patient. The second radiographer is the one who is responsible for the processing of the exposed cassette. Right after checking the developed image, he will notify the COVID staff radiographer that the image is already processed. Diagnostic ultrasound, also called diagnostic medical sonography, an imaging method that uses high-frequency sound waves to produce images of structures within your body. The images can provide information for diagnosing and treating a variety of diseases and conditions. Preparations for ultrasound. All scans that needed to visualize the upper abdominal area should have at least 6 to 8 hours fasting for adult and 4 hours for pediatrics. Full bladder is instructed for procedures concerning with urinary tract, lower abdomen, and aids in better visualizations of organ anatomical orientation. An electrocardiogram or ECG is a simple test that can be used to check your heart's rhythm and electrical activity. Sensors are attached to the skin to detect the electrical signals produced by your heart each time it beats. Upper garments, accessories, and jewelries should be removed before the procedure to obtain a satisfactory result. COVID-positive patients are usually done in the emergency room and isolation area to avoid the exposure of non-COVID patients. Computed tomography, also referred to as a CT or CAT scan, an advanced radiological imaging modality in which an X-ray beam rotates around the patient. It can visualize the internal portion of the organs and separate overlapping structures precisely. Producing cross-sectional images of all parts of the body, it takes pictures that show very thin slices of your bones, muscles, organs, and blood vessels, so that healthcare providers can see your body in great detail. For intravenous contrast studies, the radiographer will ask for the result of creatinine. Normally, your kidneys filter creatinine from your blood and send it out of the body in your urine. If there is a problem with your kidneys, creatinine can build up in the blood and less will be released in urine. Inform the patient for at least 3 to 4 hours NPO or nothing per orem. NPO is usually prescribed as a safety precaution. Without it, you can become nauseous once contrast or sedation is administered because you have something in your stomach that can lead to aspiration. Standard operating procedure for CT scan examination are as follows. The patient should be well informed in due time for him to arrange his schedule for the procedure. Preliminary preparation must be well instructed to ensure better visualization of intra-abdominal structures. Be sure the part of interest is free from any metallic objects which can produce artifacts to avoid re-exposure. Check last menstrual period, especially to childbearing patients, to avoid the risk of being exposed. The official results for normal studies are released after 24 hours, while special procedures are released after 48 hours depending on the severity of the case. CT scan plays a vital role in the diagnosis of coronavirus. The severity of COVID-19 is related, in a large measure, to the extent of pulmonary involvement. The role of chest CT imaging in the management of patients with COVID-19 has evolved since the onset of the pandemic. The usefulness of CT imaging to assess prognosis, to guide management, and to identify acute pulmonary complications. In order to monitor the unexpected errors such as motion, cut-off images, and presence of foreign bodies, a spoilage logbook is provided.